Good evening, everybody. I was making sure that you were recording. Give me a second.
Yes, I have the recording on.
All right. So good evening, everybody, and welcome to the very first activity that we're having for this year's Health Policy Camp. This is a panel conversation, entitled Building Advocacy Power, Political Determinants of Health and Multi-Generational Leadership. I'm Chiyomo Rue. I'm the Health Justice Project Director here at AJE, and we're joined by my co-facilitator, Yvette Ingram, who's one of our esteemed parent ambassadors. Yvette, I'll just say a little bit about Yvette. She is a mother of three daughters, and one of whom is neurodivergent, recently diagnosed. And she was introduced to us via Children's National's Parent Navigator program, one of the navigators, Hector Reisenberg. And so since then, Yvette has been with us for over a year now from the last policy camp. She is a trailblazing leader. So grateful and proud to have her join us tonight. Yvette, do you want to say a few things before we get started?
I just wanted to say good evening, everyone, and I'm just happy to be here.
Great, great, great. Thank you. So just moving and grooving, knowing that we have such a limited time for a rich discussion. The community,
Sorry,
I just want
To
to.
interrupt. I just wanted to make sure that those who need interpretation, if you click the globe, you'll be able to get Spanish interpretation. Si necesitas que la reunión de hoy día sea en español, si vas en los tres puntos, hay un círculo alrededor de esos tres puntos y haces cliqueo en un mapa, es un círculo que dice interpretación, puedes escuchar esto en español.
Thank you, Danny. All right. So, and I'll make sure to pace myself and encourage all of our speakers to pace ourselves for the interpreters. So our community agreements for our Zoom, and these are some of the agreements that we share with our parent ambassadors on a weekly basis, and we hope we're just bringing you guys into the cultural fold of how we roll here at AJE. And so we hope that folks are willing to listen, to understand, honor lived experience is expertise, speak from your own experiences, be mindful of time so everyone has the opportunity to participate, assume positive intent while remaining open to learning, keep our conversations solutions focused, and respect privacy and confidentiality for all. And, just by any emoji that you want, a thumbs up, just want to get people's consent with these agreements. If you're on board, please just give us an emoji. Thank you all. Appreciate that. I just want to take the time and give some acknowledgments while we're getting all these thumbs up. Thank you all. Um, before we move into discussions, I want to recognize if there are other uh, people that are in our community, in our network, if there are other members of the Community Health Advisory Panel or CHAP, if there are any members of the DC Council offices that we invited to also join in, and feel free to just drop a hello in the chat so that we know that you're here. And we're grateful for everyone that is here. And we're grateful for our parent ambassador. And if you're a parent ambassador, drop a chat. I see a few of our parent ambassadors in the meeting. So just drop a chat if you're part of CHAP, if you're a parent ambassador, or if you're a member of the city council and just want to be acknowledged for your presence. Um, just want to be a few housekeeping things here in terms of some announcements that we think are important and that we will be announcing throughout the health policy camp is that we hope that you check out the My Child Find storytelling campaign. We're collecting stories, past and present, of families that have navigated their experiences, their first time your child was identified. We want to know your story. We hope you take the time out to fill out, if you click on the QR code there, you'll be able to grab the Google link, Google Forms link, and if you want to schedule a time for somebody to interview you, if you want to submit a video, we take all forms and we want to make sure that it's accessible to all. You are not obligated to reveal your identity. You can notate that you want it to be a confidential storytelling. But we're excited to get these stories because they're going to help us understand, globally and just help us with a creative project here in which we're doing to know how families are navigating from the start of their journey at whatever point that journey began, which is what Child Find suggests. We also encourage everyone to stay connected through the Health Policy Camp and attend all our other sessions. There are many others, and I think there's a QR code for that as well, Danny, right? And you can register for our next workshop, which is on Thursday, and we have a few in-person events that are coming just back to back to back. On Friday, we have our community health advisory panel. It's going to be at MLK Library. On Saturday, we have a parent cafe. So if you're a parent, we'd love for you to be present with us in that capacity. And on Monday, we have a creative showcase. And a panel discussion following, but the Creative Showcase is a play written by one of our youth advisory board members. So we're excited for that to be implemented. And we have our live binder. The last announcement here is that in the live binder, there's a link to that Danny's going to pop in the chat. It's just you can see the entire agenda for the entire health policy camp. You can see the flyers with the registration links for each event in case you want to also catch it there. You can also see information, or we have one pagers, and we'll keep uploading one pagers throughout the camp. So keep coming back to it because there'll be more one pagers that kind of capture the spirit of each session that we have. And you'll see in the live binder, particularly for tonight, there are one pagers reflective on the political and social determinants of health, on disability justice, the principles of disability justice, and on the 2Gen engagement framework. So I will I will pass it to Danny to launch the first Zoom poll question for you all. Danny, are you ready?
Sorry, y'all, give me 1 second. I was just dropping these links. I'm going to drop the last one. So while I'm just getting ready to drop that link, if you are able to click on the two one pages that I have dropped so far, you will be able to see and reference these throughout our conversation. Okay, there you go. Thank you, Chioma. So the first question, which factors have the greatest impact on health in your community? So you can select up to 3 responses. Okay, great. We have 10 responses. Let's try to get some closer to 20. Great. Okay, so while people are still voting, some of the major ones that we have are environmental conditions, quality schools, employment and income. And in just a little bit, once I get a couple more votes, I'll share the results so you all can see. Okay, we have 15 responses. And then food security being another one. Okay, I'm at 18. Let's try to get a couple more. And I really appreciate just you all taking the time to give us this feedback. It definitely helps with all of our projects, and just showing the impact that we have with the changes that we're trying to support in accessing healthcare. All right, so I'm going to end that poll. And as you can see, affordable housing, access to healthcare, quality schools, were some of the biggest ones. And well, some of the ones that had the most votes, and also food security. All right, thank you. I'll pass it back to Chioma to just go ahead and review the community agreements. I'll share my screen.
Thanks so much, Nanny. Very interesting results here. Looks again at quality schools, which is not surprising considering this is the AJE crowd. I think everyone's on brand with that. And just reviewing the community agreements before we move forward again is we ask everyone that's here to listen, to understand, to honor lived experience as expertise. Speak from your own experience, be mindful of time so everyone has the opportunity to participate. Assume positive intent while remaining open to learning and keep solutions in the conversations solution oriented and respect for privacy and confidentiality because we're going to be unpacking some, you know, big things tonight and every night that we're engaging in this camp. Turn my ringer off. Okay. All right. So I just want to go back to the live binder. So in the live binder and the links that Danny dropped in the chat, just want to recap on some defining terms that are grounding terms for this dialogue that we're going to have tonight. Um, I want to introduce concepts of the social determinants of health, the political determinants of health, disability justice, and the two-gen framework. In terms of the social and political determinants of health, it's the social determinants of health in sum are the conditions in which children or people are born and grow, learn, and it includes all the things that we just took the Zoom poll, right? Like safe housing and family economic security and access to food and water and access to accessibilities like language and cultural safety. Now, the political determinant, these things are determinant of our outcomes, how our lives turn out. In terms of the political determinants of health, they are more about the structures and the systems that inform how these social determinants of health actually function and what determines if they're accessible or not. So they are about the laws, the policies, the budgets, the funding decisions, the leadership structure that shape the conditions of people's lives in DC and any other environment. And so things about healthcare access, like Medicaid eligibility or access to insurance for immigrant families, uh, issues like school discipline and how schools implement IEP, IDEA, IEP policies, things of like how does the city council work, particularly around budget season and oversight hearings and how you can democratically give feedback when things aren't working to the best of their ability, what you can do about it. Understanding how you can ask and your rights in terms of accessibility and what the ADA has to say about that, the Americans with Disabilities Act or the 504, Section 504 of the 1973 Rehabilitation Act, fair housing policies. All these things are laws that are written by people, that are by elected people that are elected, and people go and they vote like this is an election year. And our abilities to participate in these processes and for these processes to work, these are political determinants of health. These also shape how life outcomes. Now, in terms of disability justice, now there are many ways that one can frame disability justice. We are, you know, of the more radical ilk over here in the Health Justice Project. So we're going by the 10 principles of the disability justice, which is grounded and founded by Sins Invalid, which is a network of Black and Brown disabled people of color that got together and recognized that there is a unique experience within disability systems as you're navigating as a self-advocate or as a family member. You'll see on there we have a book reading, a book recommendation. And for our parent ambassadors for cohort 5, we onboarded a cohort of parent ambassadors this year. They will each get a copy of this, and we encourage everyone to support a local author who wrote this book called To Be a Problem, a Black woman's survival in the racist disability rights movement. And this book is a grounding book around these 10 principles and gives a personal narrative that helps understand. But I'm just going to go through just the 10 principles, and you can do a deeper dive on your own. There's intersectionality. That's principle 1. Leadership of the most impacted. Anti-capitalist politics, commitment to cross-movement organizing, recognizing wholeness, sustainability, commitment to cross disability solidarity, interdependence, collective access, and collective liberation. And throughout our work here at AJE, and particularly in the Health Justice Project, we do our best to align and align our practices, our internal practices to these principles as best as possible. Of course, we're not perfect, and we hope that you join us in holding us accountable and creating this disability culture in the way of these principles, because it does also make a difference in determining access to safe housing, access to paid family leave, right? There are ideas behind every policy. And if those ideas are not informed by disability justice, then it's likely going to be informed by something very ableist. So this is why it's important to ground ourselves in these ideas and push them out in all the ways that they matter in the political determinants of health and in the real politic that determines our lives. And so the last concept I'm going to ground us here, it's on the multi-gen or the two-gen
Recording in progress.
the two-gen framework. Please put yourselves on mute if you're not speaking. If you're just coming in, please mute yourself. Thank you. Um, so just in short, the two-gen process or framework, again, there are different ideas around this concept. We're taking from the Aspen Institute, the Ascended Aspen Institute, which identifies 5 key principles around two-gen policies that we know that if we are adopting these policies that form a multi-generational framework, that we are having better outcomes. So accounting for outcomes for both children and adults, right? That should be a very simple concept, but we know that systems have a hard time looking at the child and the parent at the same time, right? And because we know that the needs of the child and the youth and the needs of the parent are different and sometimes can conflict or sometimes can feel redundant, and there needs to be whole systems approach to be able to address the uniqueness of this both children and adults in terms of outcomes. Another principle here is that to listen to the voices and recommendations of the families as a whole, as a household as a whole, right? When we say families and when we say family centered, we're not just centering parents, right? We're also centering the children that make the home for the parents, right? Like they are individuals as much as they are a collective. And the more inclusive those voices are, the better our democracy will work. And to ensure that we're also, again, approaching from intersectional lens, taking into account racial dynamics, gender dynamics, economic conditions, and seeking all of these through an equity lens. and to foster evidence and innovation together as in what do youth and children have to say about innovation? What do parents and caregivers of different generations have to say about innovation? And what do our systems do to ensure that their voices and their vision are impacting where we go with these innovative things that do actually make a difference in our lives. And then the last point here is to align and link systems and funding streams, right? We need our systems to put their money where the mouth is. It's great to say you love to Gen. It's another thing to invest in programs and functions and evaluation tools that measure that. So without further delay, that we have limited time here. That's why the live binder is there. We hope that you take time to digest these concepts, download them, share them. These are open source. And we hope because the more that everyone here is informed, the more that everyone here is adopting these ideas, the better that we can function as a city, as Washingtonians, and anywhere else that we will navigate in our lives. So I want to introduce now, moving towards our speakers. I'm going to read their bios and go from there. So let me pull this up so that I'm reading from the right place here. So our first speaker I'm going to introduce for this first panel here is Rhonda White. Rhonda White is a dear friend, an amazing mother advocate, and is a strong disability advocate, family ambassador, and community connector. Her youngest daughter, beautiful soul, amazing human, um, with special needs, influenced her entry into disability advocacy. As a parent advocate for her daughter, Ms. White has fully exercised her drive and passion for family advocacy in her roles as a resource specialist to Family and Community Engagement Liaison at Quality Trust for Individuals with Disabilities, which is an allied disability organization here in DC. Um, through her leadership and coordinating Quality Trust Family Ties of DC program and co-chairing the Family Support Council, which I'm also proud to be a member of, and it's under the DC Department on Disability Services. She has helped to strengthen family support systems in our communities. For over 18 years, Quality Trust has well, Rhonda has dedicated her time of quality trust to offer dedication, compassion, leadership, and just made a long-lasting impact on numerous families in this and members of the disability community, which I'm grateful for her. As I was beginning my journey, Rhonda was one of the warrior mothers of the Underground Railroad that really helped get me together. So I'm eternally grateful. And so I'm going to read Andrea Trujillo's bio here, who's our other speaker. Andrea is a dedicated special education teacher, educator, and instructional leader with over 20 years of experience serving students from preschool through high school. She currently works as a special education teacher with DCPS, supporting young DCPS as in the District of Columbia Public Schools, supporting young learners in the pre-K category. And through her career, Andrea has served as a special education teacher, curriculum and instruction specialist, and English teacher with expertise in differentiated instruction, individualized learning, and supporting students with diverse learning needs. She holds multiple teaching credentials and certifications in special education, applied behavioral analysis, ABA, autism spectrum disorder, and educational administration. Hey, Andrea, do you want to come to my home and like special tutor my kids? Just to drop that. And
Um,
since
on my way,
2000,
on my way, on my way.
since 2001, Andrea has also served as a camp director for the National Turner Syndrome Camp, Down syndrome camp, I'm assuming that is, where she helps create meaningful experiences that foster connection, confidence, and independence for youth with Turner syndrome. No, you meant Turner syndrome. Andrea is passionate about empowering students, supporting families, and creating inclusive learning environments where every learner can thrive. So that's just a little bit about our speakers. I am going to pass it to you guys. Well, I guess also Yvette, is also going to engage us here with some probing questions or leading questions as we engage in dialogue. And I'm going to go on mute.
Good evening again, everyone. My name is Yvette Ingram, Parent Ambassador with AJE. We're going to start with round one, understanding political detriments of health. To begin, I'd like each of you to briefly introduce yourselves and tell us what inspired you to do this work with the communities you serve. We'll start with Rhonda first and then Andrea.
Good evening, everyone. As they stated, my name is Rhonda White, and my most important job was the parent to my youngest daughter, who had a rare diagnosis of Cornelia de Lange syndrome. And with that syndrome, there were multiple support needs due to that syndrome. And so, as you heard in my bio, she is my inspiration for the work that I do today. I did not go to school for advocacy, but because of her need, and I saw the need of many other people with disabilities and their families and their support system that needed the same help that I was looking for. And I had an attitude of I refused to see another parent, another person with a disability not be able to access resources to have the fullest life that they would desire. So I'm glad to be here and thank you for inviting me.
Hey, my name is Andrea Trujillo. I became interested in this work because I noticed teaching in various districts in California and then moving to DCPS. I noticed that students with disabilities were not getting the same services. They were, unless their parents spoke up. So if they didn't have a parent to speak up or advocate to speak up for them, they might be missing out on certain services. And I didn't feel that was right. I think they should all get the services that they need and are entitled to. And so that's kind of my goal, is to make sure that the kiddos that can't speak for themselves have somebody speaking for them and are getting what they need to be their best selves.
Thank you both for your responses. My questions is for Rhonda. From your experience as both a parent and advocate, which systems have had the greatest impact on families' health and well-being?
Yes, from my experience as both a parent and a professional advocating for people with disabilities and their families, a lot of what Chioma already shared that has impacted families' health and well-being and those systems specifically around health and education and social services. I think one of the major things that those of us who advocate and support families, we forget that when you're advocating for the person with the disability, you must consider the needs of the family. So if it's a student, you're not just, worrying, concerning yourself with the IEP, but there is still a need for that family to live. So if a family is needing supports, housing, food, even the caregiver needing support, if you want that family to be a participant in the advocacy for that child with a disability or person with a disability, you must consider the well-being of the whole family, which is around coordinating these systems around health and education. I think education is a big one because I believe that the accommodations a lot of times are not thought about or ignored in education. Social services, respite. That is one area that for the well-being of the family that we are seeing that is lacking. So the coordination of these systems and being accessible and truly collaborative would really reduce the stress for a caregiver. And hopefully these systems can learn to work together and not to just move the family from one system to another, but working together for their well-being. Thank you.
I have another question for you, Rhonda, actually two more.
Okay.
How has the COVID-19 pandemic changed the social detriments of health affecting children and families?
Well, I think all of us can think of about 10 things in our own personal lives about what COVID pandemic changed for us and for our particular community. COVID has now caused an increase or cause an increase in waiting lists to get services and supports, provider shortage, even the respite. I spoke about that before, but before the pandemic, there were some options for families that had, specifically families with children with multiple healthcare needs, that they truly had some respite. Now that we're on the other side of COVID, the caregiver has to stay there while someone is supposedly giving them respite. And that's not really respite if the parent has to stay there in order to do the care needs. So that's a major piece that it drains the caregiver. Also, telehealth, virtual learning, that all is things that have affected the family's lives. Even the need for local and national data about concerning our community. I think this is really, really important because if we don't have that data, then that data can't be used by the government that gives funding to our programs and to the systems. Those, if they don't have the true numbers of those who need the care, then the money's not really coming to the places it needs to be placed in all of the systems that I shared before: health, social services, education. All of those systems are not getting the accurate number of people that are truly in need to make sure it's allocated appropriately. Thank you.
Thank you. And the last question for this moment. As more agencies and healthcare systems rely on online portals, electronic notifications, and communications, how has this changed families' ability to access services and benefits? Thank you.
Yes, this is one of the areas that I am seeing this exceptional need for supports to access the databases within the systems we use and the lack of support or education that is given to families. One of the example I will give, both personal and concerning another family that I support. When my daughter was I had made some changes within her Social Security supports, right? And I contacted them to, tell them to update some things. Within a day or two, I received a call from HSCSN saying that Trinity would not have, my daughter would not have services at the end of the month, which that was the next day. So of course, my goal was to contact Social Security to inquire about this issue. And within that conversation, they said, that's not accurate. And I asked them, could they send me the paperwork that says that she's receiving Social Security? And she said, oh, I'll send it to you. And I said, oh, don't send it by mail. Send it through the Social Security Administration database. And she goes, oh, you have an account? I said, yes, I have an account. So my point in saying that example is that she was able to get that to me, that form, within 15 minutes, instead of 2 weeks waiting for the form to come. There's a loss of services, loss of nursing, because all of that would trigger a whole reader certification process. I mean, all kinds of things could have triggered. And what I'm finding through another example of a family that I support, I was sharing in a support group meeting that it's necessary for parents to have direct, are using those systems, the Social Security Administration, District Direct. I had a parent where I had given a meeting, and at this meeting, support group meeting, I shared the importance of accessing these systems. She did it the next day, meaning Monday after the Saturday meeting, and she said this time she was accessing District Direct, which is what we use to access your Medicaid and social services, right? She had had so much trouble trying to get her son's Medicaid figured out, come to find out, they center the information, they send it in district direct. So parents have to, we must be accessing these systems because they may have said they sent it, but they didn't tell you they sent it in the system, or they may not have sent it at all. But it's crucial that parents access these systems, know how to access them. Yes, they can be challenging. They can make you go through all these security checks. But my push to some of those who work in healthcare finance is that there needs to be designated persons to assist with those things, assist with recertification, because that can be done. You can scan on your phone the document and place it into the system, but that's because there is lacking support in those areas. So I could go on that, but I will proceed to allow the next question. Thank you.
That is so true. That is so true. Thank you,
Mhm.
Miss Rhonda. Thank you so
Mhm.
much for sharing these important insights. Thank you
You're
so
very,
much. I appreciate it. We
you're very
appreciate it.
welcome. Mhm.
Um, Now we'll be moving to education. Andrea, these questions are for you. From your experience as a special education educator and instructional leader for over 20 years, what are some of the most common barriers students with disabilities or special healthcare needs face in the classroom school system?
One of the biggest barriers as I've seen in my experience is just access to community, inclusion in community. It, you know, there is a lack of enough staff to help facilitate that, so they don't get to participate in things because without enough staff, it can't be done. Like you can't, the behaviors distract, and so it makes it more difficult to include them. Um, Another barrier is just parent education. As Miss Verona said, if they are not familiar with, technology, they don't know, maybe it's a language thing. They don't know how to access these systems, so they don't know where the information is coming, and it just gets, well, they didn't reply, even though they might have replied, they just didn't know to look for it. Um, those are two big barriers that I've seen for students with disabilities.
I have two more for you as well.
Yes,
What
ma'am.
effect has the COVID-19 pandemic had on the students with disabilities or special healthcare needs academically, socially, behaviorally, and emotionally within the school environment?
So socially, it has affected them because they haven't been exposed to peer modeling. They don't have that, they're in home all day, they don't get out, they don't get to hear other children talk, get to see how they play, which also affects their behavior because they don't get to see how other children behave in certain situations, what's okay, what's appropriate. Um, Academically, just exposure, because they don't have the attention span to, get as much academic instruction, receive it. And so, they don't have that exposure to academics when they can only get short glimpses. And when it has to be only through virtual, it makes it more difficult when you can't do the hands-on things. And behaviorally, just, trying to get them to understand that there's certain ways you behave in public or at school and certain ways you behave at home. If they're only at home, they don't need to use the other two, so they don't get to practice it, which makes it difficult for them to practice and gain those behaviors that allow them to engage in the community.
Thank you. And the last question for this moment. How do issues like housing, instability, transportation, food insecurity, or inconsistent healthcare show up in students' educational experiences?
It shows up in their educational experiences because as teachers, we can't begin instruction if the student is hungry and can't focus. If they show up hungry, they can't focus. We can't provide the instruction if students can't get to school. So parents can't get them to school because there's no bus or this, that, or the other. And also parents don't have childcare, so they can't, take off work, so they have to leave the child with someone else that can't get them to school. They lose the instruction that way. Um, Housing, if they're not in the same house, they might not be able to get to school because they had to stay somewhere else for that time and they couldn't get to school that way. Um, it just loses them a lot of access to instruction and engagement in the community.
Thank you, Andrea, for your
Yeah.
perspective. It helps us to see education and health. Um, excuse me. Thank you for your perspective. It helps us see education and health are deeply interconnected, how they are deeply interconnected. I will pass
Thank
it
you for
back
having me.
to Launch Zoom. Thank you so much.
Okay, so sorry, y'all. The camera's off because my internet is having some trouble, but we're going to launch the second Zoom poll for question 2. What issues should DC prioritize to improve outcomes for children and families? And you can select up to 2 responses. Last time we got about 18 people, so hopefully as more people have joined, more of you can fill out the poll. Great, we have 7 people. Okay, let me see. All right, we have 14 people so far. Go ahead and keep putting in your answers. For right now, we have 53% at affordable housing. And some of the ones that have the most answers right now are inclusive education, transportation access, early childhood supports, food security. Um, and we keep seeing some similar ones. Okay. All right, in just a moment, I'll go ahead and share the poll results so you can see where we all landed. Great. So early childhood supports is one of the biggest ones that I see along with affordable housing. And I do want to say that just referencing back to so many people navigating early childhood supports. We are collecting stories and your experiences of navigating that. So we will definitely make sure to share that again with you all if any of you are passionate about sharing that story. And we would love to put it out there to continue our efforts in advocacy. So let me go back. I should end the poll. Great. Oh, I'm sorry. I realized I was never sharing the results. Give me one second. So yeah, you can all see right there. Okay. So now I'll pass it back to Yvette so that we can go over some more questions.
Thank you, Danny. We'll be moving to round 2, multi-generational leadership and disability justice. I'd like to shift our conversation towards families and leadership. These questions are for both panelists. What unique challenges do young parents and caregivers face today? We can start with Andrea first and then Rhonda.
So I think young parents face the challenge, of finding childcare. It's very difficult to find somebody you trust to leave your child with. And not every work, not every work site has flexible hours where you can work around your child's school schedule. So sometimes, finding childcare can be challenging if you don't have family, you don't have that social network. Another challenge is just, get education. If you're young, you haven't, had experience, you don't necessarily know what to look for, where to go for the information. You might not think to look for certain information if you're young.
Yes, Andrea, you're so right about the child care. I think the other thing with young parents is that for those of us who are advocating and supporting them, we have to remember the sensitivity, right? That they just found out the diagnosis, right? They're still going through a process to some degree of denial, thinking about now how their whole present and future has changed and what they initially thought when, they birthed their child. Or became a father. So we have to be very sensitive. So because of that, their focus is not where we would desire in the sense of putting all of this information and processes at their plate. Well, first of all, I do think what I found with a lot of parents that come to Family Ties of DC that are young, they really are coming to me, even though they're 6 or 7. I should be in HSCSN and all of those places we know that support our community. They should have access to them very early. I'm still getting parents that say they don't even know anything about health services for children with special needs. And at 5 and 6, how is that, right? If they've known the diagnosis since 3 and 2, why is that happening, right? Something's wrong. So my point in saying that young parents and caregivers are still not connecting to the resources and information they need. And when they do, bombarding them with all of that information without explanation can be very overwhelming. They're still trying to process all of these things. So I think we have to keep that in mind in our efforts to advocate for them, that it's a very sensitive time and there needs to be extra explanation, more repeating maybe what you said before, right? Because they may have other children that they followed a whole different process, right? And now this is all new. So just keeping in mind that they're dealing with those emotions and still trying to digest all the information that they're receiving. Thank you.
Moving to the next question for you both. How does caregiver well-being influence child outcomes?
I'm sorry, can you repeat the question one more time?
I'm sorry. How does caregiver well-being influence child outcomes?
So if the caregiver has enough, respite, enough time to take care of their needs as well as the family needs in general, they can focus on how the child does, their success, um, and they're better able to provide for all the needs, make sure that the needs are met and that they're provided the best that they can be provided.
Right. Thank you, Andrea. As for that question, one of the things I think we really need to think about after the pandemic, there was obviously a growing concern for caregivers and their well-being. I have, to me, a very astonishing statistic that nearly 2 in 5 caregivers report multiple chronic conditions. So if the caregiver is not receiving the support they need, it makes it very, very challenging or affects the child's outcome if they're not fully present, you know what I'm saying? Because they're dealing with the mental health circumstance, condition, excuse me, or they have a new diagnosis themselves, right? So the well-being of anyone includes emotional, physical, mental, and then financial. So the financial strain that the caregiver is going through affects the child. If we talked about that, about, food, if it's the electricity bill, whatever that is to make that the home a safe home for the family, these are all the things that the caregiver's well-being is being impacted. So I really believe that, when a caregiver is overwhelmed, it's really hard to understand the IEP, or, trying to juggle the job and get to an appointment, you know what I'm saying, for, the doctor when you're still trying to keep a job. Those are very challenging. One of the things I wanted to mention too is that, um, let's take the example of a loved one in the hospital, right? And a parent trying to be there as present as possible as they care for the other family members' children, as they're trying to keep a job. And one of the things that I see lacking is that if someone's in the hospital and they get discharged, right? The child gets discharged, it is the parent is, trying to get all those loose ends together to prepare them to get home. But I'm finding that the caregiver is so overwhelmed, they're not reading the discharge papers and not really understanding the care that needs to happen when that child goes home. So we really do need to think about the caregiver, because really the caregiver and the child impact each other directly. When the child's not well, it impacts the parent. When the parent's not, in the best of condition, it affects the child. So it really is a teeter-totter, situation when it comes to parent and child and family and child. Thank you.
Thank you. And this will be the last question for this. And I just wanted to say, if anyone has any questions or comments, please put them in the chat and we will get to them later on in the meeting. This last question is, what does disability justice look like in practice, not just in theory? And when I saw this question, it stood out for me, and I would like to answer as well. But first, we would like to hear from you both first.
So disability justice to me means that students are provided with everything they need, are getting their accommodations without without anybody needing to advocate for that, just because it's what's written. It's what the student needs, it's what's best for the student. That's what it means to me, that they get what they need without needing somebody to fight for it.
Mhm. I agree with you, Andrea. We shouldn't have to get an attorney to get what's legally obligated to our children. Fair and appropriate education, faith. That there should not be an extra person there to just get what is needed so that child can thrive, not just be pushed through school, but thrive at school. And so I think that's, educational justice, is that can happen, and they transition from each part of their education career, from, coming from the early intervention to elementary school, middle school, and high school, and coming out of high school with a plan on how to live after high school. That includes them being independent as possible, being able to communicate, whether it's a communication device, whatever it may be needed, and being able to feel that they are equipped to live life as independent as possible for them. Thank you.
Thank you, ladies, both. Thank you.
Mhm.
Thank you. What disability justice looks like for me is making sure my child is getting the best treatment and services available for her need, and bringing to the forefront in spaces like this the impact it has had on my family, not being able to get the care and benefits that are available because she has a disability. The lack of interest that the Social Security system has for families with children with special needs is an insult, especially when we are required to do all of these special things. Fill out the paper, get on the phone, make the phone call, the interview. We actually seen their recommended psychiatrist, and he confirmed my daughter's diagnosis, and we were sent the denial letter stating that she wasn't blind or disabled. So, I mean, which didn't make sense to us because why did we even go through all the motions if that's what you were going to say at the end of the day is that she wasn't blind or disabled. And so I feel we should have honest systems in place that are actually focused on the very needs of children with disabilities and not having to stress as caregivers. To have people of expertise and compassion for the families will help a great deal, and the outcomes will result in our children achieving greatness in this world, being able to navigate life without falling behind and feeling left out. My daughter is currently missing out on HSCSN, and she's missing out because unless I'm approved by Social Security, we cannot get the services, and it's been a year and a half. I am currently in the process of doing it all over again. And I actually have a lawyer from Children's National. And it's like, we have to do it all over again, hoping for a different result. And so I just wanted to thank you ladies for answering these questions. And I just appreciate your time. And I would like to send it back to Danny for the Zoom poll, the third Zoom poll. Thank you.
Thank you, Yvette. I just want to, again, a huge thank you to the panelists and to Yvette, who has been a leader, such commitment, and we have seen you flourish over the past year and a half of knowing you. And I'm just so very grateful that we have the opportunity to hear from you today as well. The third Zoom poll question, and I'm loving the love on the reactions and the emojis, so keep participating as you can as well. Question three will be which statement best describes you? And so this is a one choice answer. Um, you can go ahead and click the one that best selects for you after hearing some of these discussions. We're really wanting to get an image of, well, just an idea of what your advocacy experience has been. So as we have listed many different forms of advocacy, we wanted to know which statement best describes you. And then again, for those who have just joined us, we have Spanish interpretation available. And if you have any questions, please go ahead and drop them in the chat or wait until we do the questions and answers portion of the panel. Okay, I have 12 responses so far. Let's try to get a bit more. Okay, I'll share the results in just a little bit. If you're still finalizing your answer, I'll give you about a few more seconds. Great. Okay, let me go ahead and share the poll. So we have some that have said that you've never engaged in some sort of advocacy. Maybe we could have phrased it a little bit differently because some people might have somewhat of an experience versus more. But I see that some have shared their testimony or have attended community meetings. I just want to pinpoint the sharing your testimony. Some of the things that we do through our Parent Ambassador program is continue to encourage our parent ambassadors and leaders who are in the community and navigating many of the challenges to navigating care, just to present their story and continue to share some of their experience to either DC Council or other coalitions. So next week, we're actually going to be able to speak a little bit more in depth about this, and I appreciate everyone sharing. All right, so I'll pass it back to Yvette for the final round of questions.
Thank you, Danny. We're in the final round, round 3, building advocacy power. For our final discussion round, I'd like to focus on action. These questions are for both panelists. In your experience, what makes advocacy truly effective?
Hello. Yes, I think it is effective when there's truly um, active collaboration. I kind of call it when we see different groups and organizations and government representation um, at a table. It's more like musical chairs with paper when it comes to advocating for our families. Sometimes I feel like it's just the passing of papers, right? But it's not really the collaboration to really work to the goals for that person's needs. It's like I did my piece, you do your piece, right? Instead of coming at the table and saying, let's really do active collaboration to make a change or improve or organize the plan to really support and advocate for a person. I said something, I said already about, sometimes we're just doing the bare basic, right? Let's just, get them through instead of thinking about what do they aspire being the child or even the family, that the goals that they have for their lives, and how we really take that input from the child and the parent and really make it work, and do what is necessary to make it work, because it's not just getting by. We're planning when someone, as parents, yes, we birth a child, but we're really raising them to be an adult, not raising them to be a child. We're really raising them to be an adult, and getting that mindset, parent, advocate, government system, organization, that's really what the ultimate goal is. So we're using the 18 years to do that, right? The school, the supports we get through healthcare, all of those things, working together, active collaborating together, and empowering the parent. I think we, as advocates and those who are supporters, we have to make sure we're incorporating the parent and the child in the process. Some may not know the technology, right? So make that a way that in which we empower that grandmother on how to send an email. Take that little bit of time to say, this is how you do it. This is how you set up an email account. And let's do a couple of these, right? You can send and ask for a meeting invite. And then the advocate follows back up and makes sure that is happening, whatever that is. But I believe in empowering a parent to be an active advocate. A parent is always wanting to have the best for their child, and most importantly, love their child. Therefore, they want what is needed for the child. And we want to empower a parent to be involved in that process. So I think those things, active collaboration and empowering the parent to be a part of that process, and of course, incorporating the child to be a self-advocate, and practice those same things that we do with the parent with the child. Thank you.
I agree with all of what Rhonda said, and then I also want both parties need to come in with good faith, actually willing to make change, because a lot of it is just hearing the same think over. Well, we really agree with you, but we don't have the funding for it.
Mhm.
And there's no real like providing a solution. It's like you have to provide the solution too. Yeah. So I think both parties have to go into it working for change.
Mhm.
Thank you, ladies. Two more questions. What policy changes have the greatest impact on disability justice in the District of Columbia?
My thoughts are it first, I want to go back to what we said before in regards to justice and just getting what they are obligated to have as a student, and getting those. So the greatest impact, I believe, on disability justice would be to allow the freedom to be able to access those services and supports to truly have a life that allows them to work, to live, to play, to love, without any hindrances. And someone might say, love, it, I was just part of a event where there was a couple that, had struggles of even trying to get married. You know what I'm saying? And they with IDD. And so we want to make sure that there is justice to be able to live the fullest life, right? To get exactly what was they're supposed to get. And how that's done is making sure that we make that person the center of the process with the supports of the family. Thank you.
I think I agree. I'm going to echo it. I think even in teaching, you have to address the whole person, what they need to be the best version of themselves and to be as independent, as much a part of the community as possible, to prepare them for that. Not just to prepare them, to go through the motions, but to prepare them to possibly have a job, to figure out how, if they're higher, if they, have more minor disabilities, show them how to advocate for themselves, how to take part in their IEP, how to get, their accommodations, um, just it comes down to making sure they get everything they really need. And it shouldn't always be a fight for it. It shouldn't be like, well, we don't have the funding for it. We can't provide that. It should be what they need to be their best.
Thank you. And the last question for the evening from you all. For participants who are just beginning their advocacy journey, what advice would
Okay. Did you say for those who are, could you repeat it again? I'm so sorry.
sorry, for participants who are just beginning their advocacy journey, what
Mhm.
advice would you offer?
I would first offer that you try to get all the information you can, right? Make the calls, you know what I'm saying, to those um, government agencies. I'll give you my example of what I did with my child was that I had first called 21 years ago the Department on Disability Services. And for you all know, that's really for adults, right? But because I didn't know any better, you know what I'm saying, I called them, right? And to find out, I wasn't referred at that time to where I needed to go, which is why I do the work I do today. You know what I'm saying? Then I went to the actual organization that supports the syndrome that my daughter was diagnosed, which is in Connecticut. And so as you can tell, I was making all types of calls to find out what I could get for my child here. And unfortunately, in that story, well, it worked out, but I mean, thinking of how many different calls and circles I went around to finally get to what is available here. So, my thing to someone just beginning, don't give up. Keep calling. And I'm now that we're in the era that we're in, email and more email, because email is the best way to be able to track what you're doing and others know what you've asked them to do. So as a beginner, I would get all the information you can, make Google your home, and then connect with other people, right? And for parents, trying to connect with other parents. I will take the time to um, shine a light on my program, but I do have a program, Family Ties of DC, where you can connect with another parent with a child or loved one of any age with any disability to get the emotional support, the information, the resources. Parents, I will always say, are the best resource. They can get you to places and give you understanding about how things work. So that's where I would start, right? Find peers, ask the questions of the doctor, ask the questions of the teacher, and just keep going. And of course, Family Ties of DC and AJE. Thank you. Mhm.
My advice would be to find a community of like-minded people. As Rhonda said, don't give up. If they say no, ask again. Go back and keep asking, keep showing the need. I'm a big questioner. I like to ask why. Well, why is that not? Why don't we provide that? Why can't that be done? Like, I don't understand that. Like, so just not just letting it go, questioning, pushing back, and just persistence. Persistence will get you a long way.
Thank you both for your thoughtful insights and helping us connect policy to lived experience. Thank you so, so much. I'll pass it back to Chioma.
Thanks, Yvette, and thank you both, Rhonda and Andrea. So, such an enriching conversation. So I've put in the chat, and please, this is a time where we'd love to hear from the audience. If you have any questions or comments, please feel free to put them in the chat. If you want to vocalize your thoughts, please raise your hand, and I will call on you in order of which I see your hands, and please keep your questions and comments to be as brief as possible, just in the interest of time. But I think there's one question I see already in the chat, and I'll try and frame it. And I don't know, Brandon, Cassidy, if you want to say more here, and I hope I do it justice. But I think the question is getting at what if somebody has already done multiple things that count as advocacy? What then should they do for their child if they've tried many things already?
Well, I would ask if this was someone, a parent that came to me, I'd have to ask, what have you done already, right? Because I do need to know what steps have you made, right? And if they didn't come directly to me, then sometimes it is best to really write down what have you done, right? Who have you interacted with, right? I also would say um, find, like we were saying before, investigate and getting, a supporter or an advocate to help you to go through what you have done. It's hard for me to answer, you know what I'm saying? Because I really would ask, what have you done already, right? So then it would weed out, reciprocating, you know what I'm saying, the same actions over and over again. So again, one of those planner kind of people's, put things what's down on your on the paper to see, have you really touched all of these areas and who you have touched. As a parent, I'm guilty. We don't always write things down. I know that to be true. And so that's why I say sometimes we think we have it all figured out in our heads, you know what I'm saying? But sometimes writing that down and seeing where you really stand, right? And if you want to, please feel free to add to the question if you'd like. I believe it was Brandon, right? You said? Okay, so feel free. Um,
Yeah, I just want to add, like, well, just repeat, like, write it down, kind of, so that you can see exactly what you've already done, and then you can kind of make a list of everything that's available altogether and kind of see what avenues you haven't maybe looked out to, who you haven't connected with.
So, guys, this is Brandon. I just want to clarify on this. You guys had a structured question that it was structured so that you could only pick one thing, right? And so my question really was about what if the person has done multiple things? They could do one thing, they could have done three things, right? But you instead of having it be a check the box question, you uh you had it be like you could only pick one option. And so that's why I said, what if a person has done multiple things? You can do multiple things, and you're going to do more than one thing in the course of the advocacy. But that's why I put it that way.
So am I understanding you, Brandon? You were referring to the poll questions?
Yes.
Or am I? Okay.
Yes.
Okay. Thank you, Brandon. I appreciate for you giving that understanding or clarification of what your comment was. Okay, you're referring to the poll questions.
Got it. So while we wait for Danny, do you have a question?
No, yeah, I was just going to add, I appreciate that, Brandon. It's good feedback to have as we pose more questions. This is something that we would like to do throughout the 2 weeks that we have all our events, specifically the ones on Zoom. So yeah, that's good feedback to have. Thank you. I'll pass it back to you, Chioma.
Yeah, while we wait for more questions to come in, and please don't be shy, please ask your questions. I have a question, or I have a couple of questions. I'll start with, so as we talk about building advocacy power, and we're living in very interesting times with the passage of the One Big Beautiful Bill. Um, how, my question would be, how do you see this impacting particularly young families that are just starting their journey? What are your thoughts on the bill and how they're going to impact your work as educators and advocates? And do you have any advice for how people can navigate all these Medicaid work requirements? The cuts to everything from TANF to SNAP to Social Security, even that the access ways to that are getting harder. So what are your thoughts on what the One Big Beautiful Bill, which is the one big political determinant of health that's impacting all of our lives now? Anyone, either one of you, please. Both of you, please.
Okay. Yes, a tall glass to fill, right? Because there is a lot going on with limited resources. But I am one of those advocates and parent and friend, I would say. I do believe that community is necessary. We are at a point. I kid with my support parents of the Family Ties of DC. I said, it might be one day I might need to ask you for an egg or a carton of eggs. You know what I'm saying? So we really are going to need each other, right? And there is going to need to be not just collaboration with the school, but collaboration in community, right? One of the things that before the pandemic, there used to be a lot more organizations, right, that we could go to pull from resources, right? Not flourishing, but there were more than what we have today, right? And one of the things I say to my parents about that, because those limitations are there, it's really important for you to know your community. It's really important to know your healthy collaborative within your community, the Southeast, the Northwest. Those places still exist, right? I can't say Catholic Charities does, right? The funding's gone. But there, just as I say, you need to know your police department, right? They need to know you exist, right? And your child, your family. And so I'm saying that it is important to get involved in your family and your community, and your community know you is where I'm at. As an advocate concerning the trying to get to those services, we have to get into the databases. That's where they're getting us, really. I'm being real. If my daughter was going to be taken off Medicaid in 2 days, if I hadn't have done what I did, guess what? I'd be maybe now still trying to figure out how to get her back into HSCSN. And I was told that even though that happened, if someone doesn't figure that out, let's say it's a recertification date that they're saying that that was a reason they were going to remove her, right? If if I don't get back in the system within 60, 90 days, it would be no guarantee that my daughter would get back in HSCSN. She would be on straight Medicaid, possibly. So I am back on my bandwagon about you do need to get connected to these databases and know how to access them because they are using it a way in which to say, hey, you didn't have this in order. One less person on Medicaid, one less child that doesn't need an assessment, but we know that's not true. We've been on a waiting list. But did you call every week or every 2 weeks, parent, and be the squeaky wheel? I'm waiting, I'm waiting. Sometimes they'll just remove you because they hadn't heard from you. Okay. And is it right? No. So yes, I do not have all the answers, but I know the techniques and ways in which I try my best to advocate for our families and keep them informed of what's going on. Be informed of the changes. We know they happen quickly, but you do have to stay informed. So thank you.
Vilma, do you mind repeating the question one more time, just in case other people would like to chime in, not just
And
panelists that are in
I
the
just,
room?
I just want to add, I'm going to admit, I'm unfortunately not as educated about the bill as I should be, but I do know that it's cutting things like related services, speech, and things. So going back to what Rhonda said, I think it's essential that you educate yourself, get involved with all the databases, be on top. You need to be on top of your paperwork, deadlines, and all that. You need to be on top of it.
Right, thank you. So let me ask a education focused question here. So, Andrea and Rhonda, we navigated these education systems. I wonder, as a special educator, one who has committed your entire career to disability justice from the education perspective, what is one thing you would want every general education teacher to understand about your work and just the importance of disability and inclusion in schools? And Rhonda, please feel free
I
to take
would
what
like
as a
them to
parent.
know that inclusion benefits everybody. General education students, it includes everybody. Teaches general education students, compassion, patience, and it's important to work together with the special education teachers so that we can provide an education that benefits all students.
That sounds great, Andrea. I would just add that I need any teacher to look at a child with a disability or special health needs, whatever it may be, as an individual. And I think they group them. I think every child needs to be looked at as an because every child is unique, right? So making sure that as a general educator that they're able to communicate to you and you communicate to them and they're understood because I don't care what age you are, even as us as adults sitting here, if you're not understood, it causes a problem. And it does for our children, and it will grow from year to year. So special educators really need to make sure that general educator and special educator, that their student is able to communicate and be understood when they communicate, and that when someone else is speaking to them, that they understand. May seem very simple, but believe me, it's not.
Thank you for that. And please, folks, we got 36 people in this chat. I would love to hear from you all, but I got questions, so I'm gonna keep going and for a few more, and if we're done, we could wrap up early for tonight, of course. But from a multi-gen lens, thinking about multi-generational engagement here, we know that some parents have disabilities themselves, right? And some youth are parents or are caregiving, if they're not parents as in maybe having, teen pregnancy and becoming a young parent, they may be caregiving for a sibling, or they may be caregiving for somebody else in their family that requires their attention and is taking up space in their young life. Um, what do you all think about that population, and how do you engage, how do you support a young person who is a caregiver? And what is the difference, or what are things that we as advocates and we as a community should keep in mind about young caregiving, whether parenting or sibling caregiving or otherwise?
Yes, specifically, I do have a resource for sure to share, not only Family Ties of DC, but Georgetown, I think through the Thrive Center, they do have a parent supporting program that is led by Wendy Jones, that is for parents with IDD, which is intellectual and developmental disability, under 5, right? They have children under 5, and they give supports to that parent and to the child. I was had the great opportunity to facilitate conversation through a panel of parents with IDD, and they shared their experiences as parents, right? And what they've gone through as parents with IDD. And so what I'm sharing with you, with the reason bringing that up, is not only to share the resource, but to indicate that it's important that when we say parent supports, a lot of times it's really family supports. After COVID, it became that the parent wasn't just the caregiver, the whole family became, whether they were skilled in doing that or not, because rest was taken or reduced, whatever those situations were, right? That it involved the parent. So it really is no longer, in a sense, a family support group you need. It really is family. Family now has to be a part of these conversations, part of the advocacy, right? Because they need to be educated on how to support that family. As I stated about the grandmother, right? Knowing how to access these systems, right? The technology, the databases, it entails taking the time, or whomever it might be, to share how to access those systems, because now it's not become just where I'm going. It's not just parent support anymore. It's family support. Because guess what? Maybe mom's ill now and aunt has to take over, right? So therefore, I'm getting a call from Aunt Susie. You know what I'm saying? That's not a parent, but she is now responsible for this child and now her aunt, right? So it is now, it's no longer what I call, what we typically would call Chioma. You know what I'm saying? Parent support group. It's become family now, right? Because now family caregivers, there is over $1 trillion of unpaid care that is given annually. So that means family is taking care of family and that they're not paid. $1 trillion. That's phenomenal. So that's why it's the advocacy. I forgot to say before, we do need to continue to advocate. We still need to make our voices heard, but even more because caregiving is across the lifespan. And then if you think about the numbers, that means, like I said, 2 and 5, right? Caregivers, that's every other household in a sense. So we're all being touched by being a caregiver of someone, right? Um, so the work is still needed to work together, to support one another and to reach out to those services, I think it's really important that the hospitals do a little better work, you know what I'm saying, of in letting the new parents or parents that are coming in their doors to let them know that there are supports out here. There is an AJE, there is a health service for children with special needs, there's a quality trust. I don't understand why when someone leaves with a diagnosis, they're not should be getting some one pager, a pamphlet or something that says, this is where I suggest you go, right? Um, so thank you again. Appreciate the opportunity to speak to everyone too.
And I guess Andrea, for your answering in this question, an IEP meeting can be a very intimidating environment, right? But for a young parent who is participating in their child's education, what are some things you would say to them to make that a successful engagement with the school?
I would go prepared with questions. I would write them down because you're going to forget in the meeting. I would, stop them and ask them to clarify things if you don't understand.
Got it. Thank you for that. I think we can, if there are no questions or comments, more questions or comments, maybe we can move to our final poll. Um, so Danny, can I pop it to you for the final poll before we close out?
So there was also an interactive activity, Chioma. I'll just let you look at that while I launch the poll. So the fourth poll question, let me launch it.
Oh, I see. So
I can go
I
through the question and we can go back to that.
Yes, yes, sorry, I'm seeing that interactive. I missed that part. So, as we begin to wrap up here, I like just one moment for the both of you to reflect. Um, in one sentence, Rhonda and Andrea, can you
Sorry,
share
Chioma.
what
Sorry,
mhm.
Chioma. That's for all panelists. I'm sorry, all participants, not just the panelists.
All participants.
Mhm.
My bad. So anyone that's here. So if you didn't want to volunteer a comment, this is your time. I'm going to ask you questions now. So for anyone, our panelists included, what is one change you want to see in your community over the next 5 years? Please put it in the chat. I see hand raise. I'm going to start with the hand raise, but please, as we go, go ahead, Yvette. I see in the chat
Thank,
inclusion. Nathan saying inclusion.
thank. Okay. I would say get going to the top and getting rid of the old. For instance, for example, the Social Security, because they're not helping. They're not helping most. I'm one of them, so they wasn't helping me, and they're making me do extra hoops. And I feel like it said on her, her denial letter, it says she's not blind or disabled under our rules. What rules are those if y'all told me to come in here in the first place? And then it says doctors and other trained staff looked at her case and made a decision. Who is this trained staff? Well, she sent the psychiatrist that y'all recommended. And so where's active collaboration going on within, the system? So that's what I came up with. Thank you.
Thank you, Andrea. I just want to highlight um, inclusion, Nathan said. Pepper says access to resources in the community. It seems as though the families that need it most are unaware of what resources are available. I also see Andrea, you put that you'd like to see no student facing food insecurity. Here to that. Caroline is saying wraparound supports, meeting a student's whole health needs, including health care, food access, instruction, etc. Yes. Through schools by community school models. Yes to the community school model. Um, Brandon says more employment by schools of kids with certificates of completion or other standards, right? If they're going to be handing out those certificates, why not hire them? I'm with you there,
Mhm,
Brandon.
mhm.
Um, and keep them coming. And as Danny put in the chat, please feel free to come off mute and share your thoughts. Again, I'm going to read the question. So it's what is one change you want to see in your community over the next 5 years? Keep them coming.
I know we have some parent ambassadors in our meeting tonight as well. So if anyone wants to come off mute, raise your hand just to expand a little bit and share a little bit about your experience, whether you were advocating already, some of the changes that you would like to see, or based on the challenges that you're experiencing, what are some things that you would like to see as a coalition and as we continue to build community with other caregivers?
Yeah, and I see Nathan and Pepper, commenting in the chat. If you want to come off mute and say more, you said inclusion, Nathan. What more, what does that mean to you? And Pepper, do you want to say more about access to resources in the community?
Yeah, I say something. I've been advocating in my community in Ward 6. And I feel like all my life, honestly. I ain't gonna lie. I'm 41 years old. My mother brought me into this work. She was advisory neighborhood council. Could you hear me?
Yes, 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 we can hear you. Okay, that's wonderful
Yeah,
to hear.
so she brought me into this work very young. I didn't know where I was gonna take it to. And um I basically watched gentrification tear the city apart. It was like a private alarm being rung without any thought process about the people who do live here in the District of Columbia. And I just wanted to be a beacon of light for the people who did live here in DC. And it's not like I have a problem with people who move here. That's not really my issue. But I think that right to return should have been pushed forward for people who actually wanted to stay. And I was one of the people who were responsible for 211 families to return back to the District of Columbia. So yeah, man, inclusion, man. I'm very, very serious about how you treat people, especially people that look like me. I'm coming hard for them.
Yes, thank you for that. And I hear, right? Like economic inclusion, social inclusion all around, right? And Ron, I see you putting here family supports and mental health, very important co-occurring conditions to have a mental health and have another disability at the same time. The system doesn't quite know how to deal with that, right?
Without wanting to maybe, disrupt the family, right?
Yeah.
Then yeah.
Well, thank you all. I don't know if anyone else, just give space for a little bit more before we do our final poll. Any other thoughts in terms of you read that question? What is one change you want to see in your community over the next 5 years? Any other thoughts? Anyone else who's put their ideas in the chat want to come off mute? Renee, are you about to come off mute? I saw you love something. Did you say something, Renee?
Hey guys, good. I just want to say thank you for. Uh, sorry, it's a little loud in our background, but that's my son in the background. But we want to say hi.
Thank you for the sauces.
So what
Well,
is one change you want to see in the community, both
I need
Renee
some
and
this is
Michael?
Michael.
sugar.
Michael. So
I need
Michael,
sugar.
say hi, Michael. So what's
Hi.
one change you want to see in
Hi.
the community,
I need
Michael?
some sugar. That's the change I need to see. But more job opportunities for teens.
With
Yes. All
disabilities or
Just
right.
teens
without?
in general. Doesn't really matter with or without.
Okay. Yeah,
Thanks,
teens in general.
Michael.
So
And also sugar and lime.
And you better
also,
give
we're
this boy
talking. We're
some
just with
sugar. But go
Get me
life
give
skills.
me some sugar.
Well, one big thing we want to talk about is how we're so tired of having to drive to Maryland and to Virginia to get services.
Ah, yes.
Yes,
Can we
and
get
that we want
services
to start. We
in
want
the
to have
city?
services in
Yes.
DC.
Yes. Hear to that. Hear to that. Okay, thanks, Renee. And okay, so let's wrap this up. And Danny, I'm gonna pop it back to you for our final poll question.
All right, thanks everybody. So, last question. This is a single choice one again, just a heads up. So, after tonight, what action are you most likely to take? And if there are others that resonate with you, feel free to drop them in the chat as well. Okay, thank you. We got 6 responses. Keep them coming.
Hi, Michael says that he would like to share his story, but he likes to get paid for his sharing his story. But I think he has a point that he wants to have more incentives for activism other than just the intrinsic incentives, I think.
Yes, well received. Understood. Thanks, Michael.
And shout out to Michael for sharing his perspective. We appreciate it. We really wanted to make sure that more youth are involved in our conversations as well. So if you know of any and you want to share out the events, we'll share in a little bit the schedule that we have and how you can share it out to other people who may want to join our sessions these next 2 weeks. Okay.
Right. I mean, I totally even missed that. That was our two gen moment right there. Thanks, Renee, for bringing that into reality for us. Thank you. And I'm sure others are home with their children around. They're always paying attention. So your activism does have impact. You sitting here and learning is them also learning. So thank you all for being present while, you know, parenting in real time.
Yes. So some of the answers that stood out to people were trying to learn more about policy issues. So that's amazing because on July 21st, we're actually going to do a deeper dive on that. Attend a community meeting or public hearing. Some of the things that we do as the health justice team at AJE, we continue to bring families together and invite whoever wants to just show up with us to coalition meetings or specifically council meetings. And then the other two that stood out, share my story to raise awareness and champion disability inclusion through community action. So we love to see that. All right, so I'll stop sharing and then I'll pass it back to Chioma for the closing. And I'll make sure to drop the links as well.
Thank you. Thanks, Danny. So, as we close, I want to thank our incredible speakers, Rhonda White, Andrea Trujillo, and to my fabulous, amazing co-facilitator, Yvette Ingram. And just shout out to the Health Justice team, Health Justice Project team at AJE here, Daniela Gonzalez Rios. You put your foot in planning for this. You get all your flowers. Amilca Hudson, our parent organizer. Wrangling. Our PAs have showed up, and that is wonderful and amazing. So, thank you all for being here tonight, for sharing your expertise, your lived experiences, for giving energy, for being present and commitment, to playing this forward. We thank again all the participants for your thoughts, your thoughtful engagement, engaging in all these poll questions. And tonight reminds us that health is shaped not just by healthcare providers or healthcare policies. It's also or it's shaped by the policies that we create, that we allow, um, that the systems can and must improve by our democratic action, and the communities, just as Rhonda said, that we have to depend on each other. We are strong here at AJE. We're strong proponents of mutual aid and mutual support. We do have our community care kit mutual aid project that was christened. The name was named by our parent ambassadors, and our goal is to distribute um, important information and wellness goods. And we know that that's not even enough. We know that mutual aid has to mean so much more, especially in these times. We encourage everyone here to stay engaged, stay informed, attend the rest of the health policy camp events. Again, you'll find the flyers in the live binder. And we hope that you show up. Our next event is this Thursday. Actually, tomorrow we're doing a presentation at the Ward 8 Health Council. It's going to be at the UDC building. So if you are in Ward 8 or you want to trek down to Ward 8 at 3100 MLK Avenue from 10 a.m. to noon, it's always a great event and environment for healthcare advocates. And we've been given about 20 minutes to go over the work that we do with our CHAP, our Community Health Advisory Panel. That's part of the camp, but We also hope that you join us on Thursday when we're having our Navigating Education and Healthcare Systems panel, protecting access, attendance, student success. We have Colleen Sanoski from Department of Healthcare Finance, Danielle Robinette from Children's Law Center, and our very own Maria Bloyer, who we will be covering home and hospital instruction. We hope that you take action, reading and sharing our latest blogs. We have, I don't know, Danny, if you're in a position to drop in the chat, but we do have a blog that's going over our network mapping and warm referral process, some of which I'll be touching on tomorrow at the Ward 8 Health Council and sharing, share out the events. We are actively sending out each day flyers for these activities we're doing for the camp. Please reshare, repost, send them in an email or text to somebody. We want communities. And when we finish the camp, we will be uploading them to the AJE YouTube channel. So feel free to repurpose those as well. The live binder will stay live, so you can use it from now until immemorial. People are still navigating the live binder from last year. We hope these resources are useful. If there are things you want for improvement, please let us know. We do have an evaluation. We ask that you please fill that out. Danny, I don't know if you want to put that in the chat or pop it up on the screen for the QR code again. Your feedback is welcomed. And we hope that you continue, aluta continua, as they say, right? Continue to advocate for your children, your families, yourselves, right? That we're all navigating this world together and we're all in need. So but please do fill out this evaluation and helps us, do better. And together, our voices, our experiences, and collective action can create lasting change. I thank you all for spending your evening with us. We know there's many other things you can be doing tonight. We're glad that you spent this time with us, and we hope you have a wonderful and safe rest of your evening. And we look forward to seeing you at our next session tomorrow in person or virtually on Thursday. All right. Thank you all.
Thank you so much.
Thank you, Chioma, Yvette.
Thank
Thank
you.
you, everyone.
Thank you, everyone.
Appreciate y'all, everybody.
Hope you feel better.